Well, sleep apnea is basically refers to an area of medicine that is relatively new. We're talking less than 25 years that dentists or doctors have been dealing with sleep apnea. What we know now when we look at people and do sleep studies is that there are a lot of us, men particularly, especially as we get older and maybe put on a little more weight, that we have a susceptibility to, depending on, again, how we sleep, how large the neck is, the airway, is that the airway will get closed off for periods of time during the night. Uh, you may wake up and be a little tired, but not realize it because you're able to medicate yourself with some caffeine in the morning. But really what we look at this is a very dangerous situation, because if you're closing off that airway at any point during the night, and what happens is many of these people do it multiple times every hour, is that it's stressing the body and the heart. The real common scenario is that Joe was 55 years old and healthy as an ox, never been a day in the hospital, and he dropped dead today at work, or he never woke up this morning from sleep. Very often these people are sleep apneics. The coroner's report will say that Joe died of a heart or problem, or uncontrolled high blood pressure, or cardiovascular disease, these different things. Very often, if you dig deeper, Joe was a sleep apneic. And so what we want to do is, the typical question is, do you snore? Has your wife or significant other, bed partner, I think is the politically correct word we use now, has your bed partner said that they've ever heard you kind of gasp for air at night? Things like that. And again, not always is it somebody who's overweight. It can be, I've seen some amazing athletes, when we test them, they're sleep apneics. One of the advancements in sleep dentistry or sleep medicine is, in the past, in order to find out if you had sleep apnea, is you would go to a sleep center. You'd have all these wires on, you're in a very foreign environment, you have somebody in the other room watching you the whole night. Maybe during the night they may come in and change something, and people get a really bad night's worth of sleep. A lot of women will not do it. They don't feel comfortable enough in that setting. Well, now we can do a sleep study that you wear a device at night that looks a lot like a headlamp, like a camping type headlamp. You wear that overnight, 1 or 2 nights, come in, we download that data to a sleep center. Within a few hours, I have a report that will give us a very good detailed information of what went on that night, how many times maybe you had an apneic event, what your oxygen level, did it reach a certain point, how many times we call arousals, where you actually wake up at night but you don't realize it. You go back to sleep so quickly, but that's why you're not getting a good night's sleep. So we really are able to determine what's going on in the sleep. Is there a positional issue? Or if you're on your back, is it worse, which is very common. So it's not invasive, it's not expensive. You don't have to go to a sleep center to figure out if there is a problem with either sleep apnea or snoring. Some people, it's simply that the bed partner is disturbed by their snoring and they don't really have a lot of apnea, but by wearing a simple appliance at night, we can reposition the jaw so that the airway doesn't close off, and we can stop the snoring. As somebody who's a clinician, I'm more interested in stopping their apnea. I really believe this is one of the areas of dentistry where we can save lives. The old, again, cliche that it's just a tooth. Dentistry is just a tooth or teeth. We're just fixing up that. This is, we're looking at the whole body. And unfortunately, dentists are not really clued in enough yet on sleep apnea, so you don't see it as much. You're seeing it more. But this is something that I want every person that comes into our office to be asked a few simple questions. Do you snore? Do you feel like you might have apnea? Has a bed partner ever told you that you snore or gasp for air? If you even come close to answering yes to any of those, we should have you do a sleep test. And then from that sleep test, we can determine whether you need either treatment we can do, simple oral appliances, or do we need to send you for some more advanced type things like a CPAP machine or something of that nature. So again, this is something that we need to look at. It's a very important area of dentistry.
At this point?
2 reasons. Sleep medicine has kind of gone into the dentistry or sleep dentistry because now we have appliances, mandibular repositioning devices, where we can hold the jaw forward so the airway doesn't collapse and close. we're the only ones that can do that as dentists. Physicians can't do that. So that kind of brought dentists into the equation. Second of that is now those devices have been around long enough and there's enough research that we know that they work. 5-10 years ago, the sleep doctors would oftentimes say, well, you don't want an oral appliance, you need CPAP. The problem with CPAP, which is a device that is connected to your sleep and it is forcing air into the person's mouth, they work. They are still your gold standard. The problem is people don't wear them. They're not real sexy to bring to bed, to have a hose connected to your face all night long. Also people that move around a lot at night, they're getting wrapped in the hose, they just don't like it. So the compliance with a CPAP is very poor. Because of that, if we can correct them with a simple appliance that you wear at night, the compliance of those is much better. Now that we know they work, this has kind of brought dentists into the equation. Another thing that's real important is dentists like myself and Dr. Adler, who have studied extensively in neuromuscular dentistry, understanding occlusion, understanding airways and arch development. Many of our people that we're working on that have reconstructive needs, they also have sleep apnea problems because a lot of these malformed arches where people are really crowded or lost teeth or their bite has collapsed from grinding, these people are the same people who are sleep apneics. So these things are tied together really closely. So that's a couple of reasons why sleep dentistry has kind of come to the forefront in an office like this.